Hello, my name is Laura Kelly, and this is the Caritas Process 7 in Aesthetic Nursing, enhancing the teaching learning experience. And the Caritas process are integral to nursing practice, and we'll discuss on Caritas Process 7 and its relevance in aesthetic nursing within medical spas, highlighting its impact on patient care and outcomes. Caring science background, a little bit about that, is an interdisciplinary field that integrates knowledge from various disciplines to understand the healing power of human caring, and that is from Watson. Gene Watson's theory of human caring comprises 10 creative processes that guide nursing practice, emphasizing the importance of human relationships in promoting healing. And then the foundations of the creative process, I've chose number 7 in relating to my field that I'm currently in aesthetics in the last 4 years. It's a genuine teaching, learning experience. We're going to talk about the importance of understanding the patient's perspective and staying within the patient's frame of reference, how they would understand what you're trying to educate them on and teach them on. Caritas Process 7 focuses on engaging in genuine teaching, learning experiences that attend to unity of being and subjective meaning. And that was what Watson discussed about when it was written in 2018. And this process emphasizes the importance of understanding the patient's perspective and staying within their frame of reference to promote patient-centered care. I think that's very important when we are to make sure that our patients actually understand us. And in aesthetic nursing, the role of the aesthetic nurse, common treatments and procedures, putting this Caritas 7 in perspective, we're going to talk about aesthetic nursing and the importance of patient education, which I can't stress enough, especially in my field. I feel like I'm a broken record sometimes when it comes to aesthetics in nursing and when I'm teaching the clients. Aesthetic nurses and medical spas provide various treatments and procedures: Botox, dermal fillers, laser hair reduction. Currently in my field, we do melasma and sclerotherapy. We do laser for veins, you name it. We pretty much are doing it. Anything that is short of going into plastic surgery. Patient education is crucial in this setting to ensure patients' understanding of the process, risks, and benefits of each treatment. A clinical example, we'll start with Botox. It's a neuromodulator, and the patient's concerns and questions are important, and the importance in addressing misconceptions, teaching, learning experience to address concerns. Those are the 3 things we could talk about within the clinical example of Botox. A patient may have concerns or misconceptions about Botox treatments, such as the risks involved and the process, the expected results. This is probably on a daily basis. I have a lot of clients that come in. Maybe they've just started and they don't know. They just know they want to look and feel their best. They want to look better. What does it do? They usually want a neurotoxin here, but it's a lot of education going in regarding what muscles depress and which ones elevate, and even all the way down to the needles that we'll be placing for the treatment. They have their concerns and their fears, and the associated risks. Very minimal, but it is, client education to have me educate enough to where when they have any questions, they feel confident they can come and ask me about them. A genuine teaching learning experience. By engaging in this, the aesthetic nurse can provide accurate information and address these concerns. I'm usually with the client a good 10, 15 minutes, sometimes 20, just discussing the treatment when they're new to aesthetic procedures at all. And I always tell them if they have any questions, to contact us. And we always reach out with a follow-up just to ensure that we care. We want them to have the best experience that they have, and that they understand side effects and brows not being shaped like they want, or lines still being present. We want our clients to be able to reach back out to me and discuss any concerns that they would have. We want to provide accurate information and address these concerns, ultimately promoting patient satisfaction, because a lot of clients come back and aren't satisfied. Not a lot, but they do have concerns. Maybe they want a brow lifted, a big one, and it wasn't lifted as much, but maybe they have extra skin. There's a lot of dynamics to go in, but the important thing is the education, because if they are not getting properly educated where they can ask the right questions, then I'm not doing my job effectively for them. And then another one is laser hair reduction. um, Understanding the patient's perspective on pain and expectations. That is, we call this laser hair reduction, not fully removal, because it doesn't always get removed completely. Um, we want to let them know some lasers do elicit some pain. Currently, mine does not, and we do have, like numbing cream, and we do have a Zimmer, which is a cool air to further for client comfort. But the aesthetic nurse can provide personalized care by educating the patient on the process, aftercare, addressing any concerns that they may have. This all just relays into education, education, education. If, like I said, if I'm not on a I'm always saying I'm not doing my job properly if they are not coming back with questions to ask. Um, Benefits of Caritas process in aesthetic nursing: enhanced patient trust, better understanding of patients' needs, improved patient satisfaction, promotion of holistic care. Um, And then implementing the process in aesthetic nursing can lead to numerous benefits, such as enhanced patient trust, a better understanding of their needs. I do. Improved patient satisfaction and promotion of holistic care. It is even a mental aspect, it's holistic. And we in the aesthetic industry, it's not just a cosmetic procedure, we are treating the entire person. This approach encourages development of strong nurse patient relationships, ultimately leading to better patient outcomes. um, then the more that we can have our client trust. And that's a very important word that my clients come back to me and go, I trust you. What do you think? I trust you. I trust whatever you're doing. And that is my end result that I really want to get my clients to have, is that they trust me, because it's like we're trusting each other, that they can come to me with what their expectations are, and we can work together with their plan of care. The challenges: time constraints, balancing a business. This is a private business. It's not in the insurance or sector. It is private, and ensuring cultural competence. So time constraints. We're a business, and people can be late to their appointments, or they can be on time or early, and also, or they can be set back, or someone takes a little extra longer. So those are some of the challenges that we do have in our private business. Balancing business and care. Again, it's a business, it's private, it's not insurance based. Cost is an issue for clients. That can be, someone is not going to be open minded to receiving that education when they are confronted with the private costs of their aesthetic treatment. So I have to take that into consideration too. And the cultural competence. I do have a lot of family members who bring in translators with them. We don't necessarily in the aesthetic world use a language line. We have an interpreter on site, Spanish speaking only. And but generally it's handled with family or even diagrams and pictures that we can discuss with the client, their plan of care. So we do have some things to our that are accessible to us to work on a plan of care that's very centered for them and for their experience. And then overcoming these challenges, again, time management, educating the staff about the importance of the Caritas process 7, which again is educating and incorporating cultural competence training. We definitely in our spa, along with the representatives of our products that we use, has brought those diagrams or those educational materials for when we are challenged with that cultural competence. So we do have cultural training, and we do have the necessary aids to reach out to our clients so that we can better give them a plan of care and they can understand when they're coming to us for these treatments. Um, so overcoming challenges and implementing strategies to better time management, educating about the importance of the Caritas process, and incorporating cultural competence training can be employed. These strategies will help create a patient-centered environment that values genuine teaching learning experiences. And enhancing aesthetic nursing practice with Caritas process. By incorporating it into aesthetic practice, outcomes can be improved. Nurse-patient relationships can be strengthened. And this approach ensures that patients are well informed, comfortable, and satisfied with the care that they are getting. Um, in conclusion, it plays a vital role in aesthetic nursing practice, particularly with medical spas. The challenge is its implementation can lead to numerous benefits, including improved patient satisfaction and outcomes. A commitment to caring science is essential for providing high quality patient centered care. Um, we are in a private sector of aesthetic nursing, and it is a step away from the hospital nursing that I had done in the past, but it definitely, um, Caritas Process 7 plays such an important role in the field that I'm at. So thank you.